we're going to work on this patient's foot and ankle. She's been dealing with some lateral ankle pain and some midfoot pain. So I'm going to just take you guys through some of the adjustments that I'll do, some of the areas that I'll typically check when I'm adjusting someone's foot. Most people don't realize that we do adjust feet, elbows, hips, all the extremities here in the office, and it's a really important part of our practice. So the first motion I'm going to check here is dorsiflexion. Okay, so I'm looking at her ability of the ankle to bend this way. Very important for squatting and other activities. You can see she has pretty good motion here, and same thing on this side. So she actually has plenty of dorsiflexion. I'm also looking for some spring in here, which she has very good spring. The second area that I'm going to check is going to be eversion, which is the ability of the heel to roll out. You can see it's pretty good there, locked up here. So we're going to do an adjustment here using the speeder board, and we're going to try to get a little bit more eversion, which is very important for the gait cycle. So I'm going to just have you rotate your leg out, and then we're just going to drop the drop piece straight down. We'll do one more. Good, and then we'll recheck. You can see that opened up right there. The next one we're going to check is going to be midfoot dorsiflexion. So we're going to check the middle of the foot here. Again, very important for gait, toe off, and plantar flexion. Okay, and we'll feel a little fixation there. We'll just get the foot to relax, and we'll thrust. Then we'll do the same thing on this side. A little stuck there through the midfoot, and thrust. So these are the adjustments that we typically look at in the foot and ankle, regardless of if someone actually has a foot and ankle complaint, if it's knee, hip, low back. We're always looking at the feet because, again, that's our attachment to the ground. A lot of disruptions in the gait cycle that can have some upstream issues are found here in the feet. The other thing that we'll do is we'll look at the soft tissues of the feet, especially if they're dealing with an ankle-specific problem. So we'll check the tibialis anterior here. A lot of times this is really tight on people, so we'll get in and we'll do some ART through here. We'll check the peroneus muscles out here on the side. These are also typically very tight. And then, of course, we'll check the gastroc and the soleus, the calf muscles. There's a lot of small muscles that flex and extend the toes. There's muscles down here in the plantar fascia. So we'll kind of get in, and usually I'll strip out everything I find below the knee, and that'll give people a lot of relief if they're dealing with a little bit of ankle instability, if they have an ankle issue, or again, even a knee issue. Because if we can kind of clear everything below the knee up, usually that allows us to track forces really well through the patella and keeps the knees nice and healthy. So